Bismillahirrahmanirrahim. Hi, this is Dr. Jamal Sayed. Today we are going to discuss the classification system for the periodontal and periodontal disease 2017. Now, what is our understanding of periodontal disease so far? So far, whatever we have the knowledge regarding periodontal disease is that there is something gingivitis, there is something periodontitis, but in the last classification of 1999 there were some lackings, and it's almost a decade that there was a need for a new classification. So the American Academy of Periodontology and the European Federation of Periodontology and with the British Society of Periodontology sat together. They co-sponsored this workshop in 2017 and came up with the new 2017 classification. So, first of all, we should know that why do we need a classification? We need a classification to diagnose, prognose, and plan a treatment, to understand the etiology and pathology of periodontal diseases, to logically and systemically separate and organize knowledge about disease, to file the facts for the future references, and to help communication among clinicians, researchers, academics, students, epidemiologists, and public health workers. So this is the background that American Academy of Periodontology, European Federation of Periodontology, and British Society of Periodontology made this classification with a very tiring job. It's a very tiring job because I understand that how many academicians, clinicians, and researchers do this work, and hours they sat together, and this after a long discussions, this beautiful classification came up. So their aim was to capture a system that can capture the severity, extent, and the rate of progression of periodontitis. So, first of all, we should know what are the main differences between the 1999 and 2017 classification. For the first time, the 2017 classification system gives us clear definitions of periodontal health and gingivitis for patients with an intact periodontium, patients with a reduced periodontium due to causes other than periodontitis, and patients with a reduced periodontium due to periodontitis. And the other difference between the previous one and this latest one is the replacement of chronic aggressive periodontitis with a single definition or single topic titled with periodontitis. And this single title, periodontitis, is based on a model on stages and grades of that disease. And then there was support given to the personalized medicine, and in the last they included the peri-implant diseases and conditions. This was the major inclusion in this classification because the previous one, implant related problems or disease and conditions were not addressed. So when we are going to examine a patient, we will go with the classification, or when we are going for a diagnosis, if we see the periodontal health is okay, fine, then our diagnosis will be periodontal health. And if there is some inflammation, some redness, then of course we will be having some classification of gingivitis, and our diagnosis will be gingivitis. And that after that, gingivitis, if the disease progresses and converts into periodontitis, then we will go for the staging and grading of this periodontal condition, and we will go for you can say to the diagnosis from periodontitis, if the stable condition is stable, and if it is, or we can treat it and we can take back to the healthy conditions, and if the condition is currently unstable. So first of all, here regarding the periodontal condition and disease, we should define what is periodontitis. Periodontitis is a chronic multifactorial inflammatory disease associated with bacterial dysbiosis and characterized by progressive destruction of the tooth supporting structure, periodontium. So its primary features include the loss of periodontal tissue support, manifested through clinical attachment loss. So there will be loss of gums, attachment loss, and the radiographic evidence will show that there is bone loss, the presence of periodontal pocketing, and many occasions gingival bleeding. So this classification of 2017 is divided into two. Number one is the periodontal disease and conditions, and the other one, as I told you, the peri-implant diseases and conditions. So these are the two divisions of this classification. And in the periodontal disease and conditions, there are three categories: periodontal health, gingival diseases and conditions, periodontitis, and other conditions affecting periodontium. In the peri-implant disease and conditions, there are four categories. Number one is the peri-implant health. Number two, peri-implant mucositis. And the third one is peri-implantitis. And the fourth is peri-implant and hard tissue deficiencies. So, if we go to the first one, there is three categories, and in the first category has again three divisions: periodontal health and gingival health, gingivitis, dental biofilm induced, and gingival diseases, non-dental biofilm induced. And then we go for the periodontitis category. There is necrotizing periodontal diseases, periodontitis, and the third is periodontitis as a manifestation of systemic disease. In this one, we will be dealing with the periodontal conditions with some relation to the systemic diseases. The third category, other conditions affecting the periodontium, has five divisions: systemic diseases or conditions affecting the periodontal supporting tissues, periodontal abscess and endodontic periodontal lesions. The third one is mucogingival deformities and conditions, traumatic occlusion forces, tooth and prosthesis related factors. So these are the five divisions in the third category of the periodontal diseases and conditions. So, as we told you earlier, there was removal of the aggressive and chronic periodontitis from this classification, the new one, and they added one title, periodontitis, and it was based on a model of staging and grading system. This staging and grading system basically has taken influence from the diagnostic oncology, in which there is cancer patients are diagnosed according to the stages in the disease, stage 1, 2, 3, like that. So it's this almost similar staging and grading system in this classification. So the staging describes the severity of the disease, how severe is periodontitis or the patient's health, and the grading shows the susceptibility of the disease. So if we talk about the staging, the stage 1, there are 4 stages in this classification. The stage 1, stage 2, stage 3, and stage 4. Stage 1 will show you the early mild condition of the periodontium. Stage 2 is moderate, 3 is severe, and the 4 will show you the very severe condition of periodontitis. So if we talk about the stage 1, if it's less than 15% bone loss or less than 2 millimeter bucketing depth, it will be stage 1. And if this is there is involvement of coronal 1/3, it will be stage 2. And if the disease progresses towards the middle third, it will be severe and stage 3. And if it's involving the apical third, it will be in stage 4 and very severe. So, and if we want to check the extent of that disease, we have to check how many teeth are involved. If 30% of teeth are involved, it will be called localized. The extent of the disease will be called, we will diagnose it as localized. And if more than 30% of teeth are involved, it will be generalized. And if there is periodontitis related condition, then we will check the molar and incisor pattern. Now we come to the grading. If we come to the grading, there are 3 grades here in the classification: grade A, B, and C. Grade A will show you, we can say that grade 1 is slow progression, and grade B is moderate again, and C will show you the rapid progression of the disease. First of all, we will talk about how we are doing this grading. Okay, so we are doing this grading A, B, and C according to the percentage bone loss divided by the age of the patient. Okay, so we have to divide the percentage bone loss with the age of the patient. Okay, so if it's 0.5, less than 0.5, it will be grade A. If it's between 0.5 to 1.0, then it will be grade B. And if it's greater than 1.0, then it will be grade C. And this grading of periodontitis is based on the British Society of Periodontology modification presented in this workshop and added in the 2017 classification. So, if we talk about what is periodontal health, so I told you there are 3 categories in the periodontal health: gingival diseases and conditions, periodontal health and gingival health. Number 2, gingivitis, dental film induced, dental biofilm induced. And the third one is gingival diseases, non-dental biofilm induced. So, if we talk about the number 1, periodontal health and gingival health, it is again divided into 2. Clinical gingival health on an intact periodontium, if the periodontium is intact. And the second is clinical gingival health on a reduced periodontium. And in this one, we have to check whether the periodontitis patient is stable, the condition of this disease is stable, or if the patient is non-periodontitis. This means that we have to check the disease in the patient. If it's there is no periodontitis, or there is periodontitis but it's in stable condition or treatable condition, manageable conditions. The second one is gingivitis dental biofilm induced. In this we have three divisions or three categories or three factors we will check for diagnosis. Associate with dental biofilm alone, if there is gingivitis and the biofilm has induced this gingivitis, if whether it is associated with only with the biofilm or mediated with systemic or local risk factors such as diabetes, smoking, or other systemic diseases. And C, we will go for the drug-influenced gingival enlargement. So whether it's affected due to some drug taken by the patient, if he's taking some other medicine or any other drug that is doing that damage or problem. So, and go for the third one, gingival diseases that are non-dental biofilm induced. A, genetic developmental disorders. B, specific infections. C, inflammatory and immune conditions. D, reactive processes. E, neoplasms or neoplastic conditions. Any. F, endocrine, nutritional and metabolic diseases. Any of this type of diseases. Traumatic lesions, any trauma that is causing this disease. And gingival pigmentation. So these are the three categories explained different points. So now we go to the form of periodontitis. This classification is also told us the form. So there are three forms according to this new classification. Necrotizing periodontal diseases, in which we have three classes: necrotizing gingivitis, necrotizing periodontitis, and necrotizing stomatitis. The second one is periodontitis as manifestation of systemic diseases, and this classification is based on the related health problems of ICD codes that can be discussed later on in any other lecture. And the third one is the periodontitis, I have discussed earlier in much detail. It involves stages, grading, and extend everything. Staging is 1, 2, 3, 4, and grading is A, B, C. So, according to this classification, then we have to check or determine the type of periodontitis, the extent of the disease, the staging of periodontitis, grading of periodontitis, and what is the current status of that disease. And of course, we have to take care of the risk factors, in which they can be localized factors or systemic factors, whatever. So for the time being, we conclude this lecture to here, and this is the part 1 concluded, and we will go for the next details regarding this classification in the part 2. So stay tuned. Until then, bye bye.